Hello, everyone. I am excited to be back here today. It's been a little bit of a little bit of been a little while. I can't even talk. I have been out of the country. I actually went on a really cool trip with an organization called HXP, Humanitarian Experience. It was with a whole bunch of teenagers. So myself and another dad, basically I was the mom of the group, but another dad of the group went, and then we had two 20 something year old trip leaders and 19 teenagers. It was a party, to say the least. Actually, I felt like I was 16 again, which was fun. I haven't felt like that in a long time. But we went and we built part of a school in Cambodia. So it was very cool. Our group was the fourth on the site. And so we did a lot of the brickwork. We were building brick walls. We were plastering all the walls. We were getting everything prepared to put stairs in. We put up tile roofing, all kinds of really cool stuff. So it was a great trip, and it was pretty intense to get home. It was 53 hours of travel to get home. We went through Singapore, Tokyo, LA, and then to Salt Lake. So it was a long time to get home, and I'm still not sleeping really great. But and I've got a bit of a cold that is lingering left over. So excuse me if I cough today. But I'm just glad to be back with you all. So I am going to jump right into questions because I've already got them coming in. But before I do that, I want to give a quick little update on the book. You're going to be starting to see a lot more information about the book. I am right now just in the middle of content edits. I have a couple weeks to get those back. And it is so fun to be able to do this editing because as I'm reading it, I'm like, I would read this book. Of course, I wrote the book, but it's been a while since I've seen it. Been a couple months since I've seen it. And there's so much amazing information here that you are going to be able to use to be able to be well. And I just cannot wait for you to get it in your hands. Right now, I'm just editing the chapter talking about how our bodies actually adapt to the environment. And there are literal changes that happen to the DNA, to the genes themselves when we have environmental things. And so we can use that in our advantage. And there's actually ways to reverse aging in cells and increase the wellness in every single cell by the things that we do. So super cool. Can't wait. Lots of information coming soon. All right, let's jump into questions because I see them coming on already. Okay, after dental work, 4 days later, my left side of my face is swollen. Can this be related? Well, for sure. If the dental work was and the fillings were on the left side of your face, absolutely. Could be two different things. Number one, you could actually have an infected tooth. So if that filling was really deep, if it infected the nerve, it could actually have already killed the tooth. That's a little quick. 4 days later seems a little quick for that to happen. If the tooth is sort of bite on, those kinds of things, then I would definitely suspect the tooth. The other thing it could be is something called a hematoma due to the anesthetic. Actually, there's three things it could be. Second thing is a hematoma due to the anesthetic. So when we're doing anesthetic on a tooth, we're kind of going blind because we can't see exactly where that's going. It's going up next to the root of the tooth. Well, there's a lot of blood vessels and things that pass through those exact structures. And sometimes the needle just passes right through a blood vessel and actually causes that blood vessel to leak, to kind of bleed into that cheek or that tissue. And if it bleeds quite a bit into the tissue, it creates a bruise and it creates swelling. So it may be a hematoma. If it is hot on there for a few days is going to really help, and an anti-inflammatories. The third thing it could be is something called an air embolism, where sometimes air can get up underneath the gum and also can cause swelling. If it feels kind of like bubble wrap, if you feel it, it kind of goes pop, 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 then that's air in the cheek. Hot on that is also important, but that sometimes you will actually need an antibiotic to prevent infection. So those are the three things that could potentially be. Why do I recommend a copper tongue scraper instead of others? So the reason is because copper is actually antimicrobial itself. So what you're doing is when you're scraping the tongue with it, you're actually cleaning it physically, but you're disinfecting it also. So everything that copper passes across is you're killing bugs also. So you're killing as well as removing. So it does two methods of cleaning. So that's why I like it. It also stays very sterile and very clean because it's antimicrobial, like I said. So you're not going to have a lot of bugs growing on it versus plastic or other surfaces. You may actually be adding things back to your tongue when you're using that because of the bacteria that's still on there. Will your book be on Audible? Absolutely. In fact, that was part of the the agreement with the publisher is that they have to give me first dibs to read the Audible, to be able to do the actual Audible reading. Do you know that not all the authors aren't always the ones that are going to do it, and they are not even sometimes offered the opportunity to read their own book? So that was part of the deal with the publisher, is that I would at least be offered, and I get to audition to read my own book first, and hopefully they pick me. But yes, we for sure will have Audible. Um, I think I'm perimenopausal. What can I do for a natural hormone therapy? All right. So this is something that I personally have been dealing with. And this is interesting. I have never, I mean, everybody has kind of ups and downs with weight, but I've always just been naturally slender. It's been something my mom actually jokes about this. My mom struggled with weight her whole life. I honestly have never really known a time that my mother is not on a diet. And my father is very naturally slim. He's very tall, very thin. And she will often joke with me. She's like, "Yeah, you got your legs from me because I married your dad." I am lucky I got some genetic, with natural slimness. But the last like year, all of a sudden I'm just packing on like 10 pounds. It doesn't matter what I eat. And all of a sudden I went, I get it now. When patients come and they tell me it doesn't matter what I eat, literally I'm eating nothing and I'm still putting on weight. Like, I get it now. This is 100% hormone related. And I think also stress related. There's a lot of things that go into it, which stress is hormone based reaction. So for sure, this is all still hormones. So I have been using a product, and I'm not even going to remember it right now in my brain. I will post about it. I've been using a product for about a month and a half, and all of a sudden something's changing. So I'm excited about it. It is all herbs. It's a natural herbal supplement. So that's one I'm using. The other thing I'm using is, if you've heard of Dr. Barbara O'Neill, a lot of people have heard about her. She's becoming very popular. Years ago, I started following Barbara O'Neill and got it's Anna's Wild Yam Cream. And I'd been using it's a natural progesterone in this wild yam. I've been using another one, and she talks about how really they aren't effective. You have to have it really made a certain way. So Anna's Wild Yam Cream, it was really hard to get for a little while. Hopefully they've upped production a bit, because I'm sure the demand has increased. I use that twice a day, morning and night. And that's a topical. And then I use a supplement, and I'll post about the supplement. And it actually is helping. It wasn't overnight. But just slowly I'm seeing a change. Can you please talk about options for a tooth with resorption? Okay, so let's even talk about what resorption means. Resorption means the tooth itself is dissolving either from the inside out or from the outside in. Something's happening. I believe it's an autoimmune process. Your body's actually destroying itself, or, fighting itself, which is autoimmune. So what do? Well, we do exactly what we're going to do for an autoimmune condition. We're going to work on strengthening the immune system. So I'm going to ramp things up with elderberry. I'm going to ramp things up with oregano to see if we can't increase the immune strength, the immune efficiency in the body. So that's the first thing. Second thing I'm going to do is I'm going to really hit this hard with hydroxyapatite. Hydroxyapatite on the outside, hydroxyapatite on the inside. Well, minerals on the inside, that's the tooth bone formula and the vitamin DK. We're going to hit it with as many minerals as absolutely possible. We also can do a laser procedure that can try to slow this down. I've never found anything that completely stops resorption, but what we find is that it can slow it down enough that it can prolong this for a long time. You can keep your tooth for a lot longer. Typically, the end game on resorption is you do end up losing the tooth, but if we can push that out years, months or years down the road, who knows what's going to be available to replace teeth in the future. So we like to push it out as far as we can. Is delayed baby teeth eruption in children related to oral issues and ties, or more to nutrient deficiencies? Okay, so I'm basically saying, if your child, excuse me, I'm just at the end of a cold here. If your child is having delayed eruption, meaning the teeth are coming in slower than they should be, is this due to, or what is this due to? What's going on? Well, there's a couple of different things. Usually it's due to a spacing problem. If there is not enough room in the mouth for teeth to come in, and this is primarily when you're getting the first permanent teeth. So these first two baby teeth are coming out, and the first permanent teeth are coming in. When that's happening, if it's delaying, they're just not coming in for a long time, usually it means there's just not enough room for it to come in. So it's getting kind of trapped and not able to come in. So that's something where we're going to hit it with what's called tooth pillow. In our office, we use what are called MyoBrace, Vivos Guide. These are all different products that will help to grow the jaw, to guide the growth and development of the jaw in a kiddo. So if we can grow the mouth while the kid's still little, then there's enough room for all those permanent teeth to come in. If there's delay in the eruption in the baby teeth themselves, what we typically find is it's not a problem. It's just that they're just delayed. And that's just their growth cycle, their growth pattern. So I don't worry if they're slow getting baby teeth. If they're slow getting permanent teeth, it means we've got to grow the mouth and make more space for them. I have large fillings in the back teeth. Are crowns a good option? So the question is, how big are the fillings? If there is not much good supported tooth structure, like if the filling extends all the way up, kind of the cusps, the high points, the mountains of the tooth, then that mountain is really weak now because quite a bit of it has been destroyed by the filling. So in that case, yes, because there's not going to be a lot to hold on to. It also depends on the situation with that filling. Has it been leaking? Is there new decay? I love what's called an onlay, which is like a partial crown. A crown goes all the way, imagine it goes all the way down to the gum line, all the way around a tooth. So all the way around, it goes down all the way to the gum line. You don't always have to take away all that tooth structure to do a crown. You don't have to take it away all the way down to the gum line. We like to do an onlay sometimes, which is just a top. So it covers over the top. It strengthens those mountains, those cusps, but we don't have to sacrifice all the enamel on the front side, on the back side to do a full crown. So look into an onlay. An onlay may be an option, but if you have a large filling, most likely you're going to need either a crown or an onlay. If I do IV antibiotics during extraction and bone grafting, is that enough to not have to take an oral antibiotic? Good question. And my surgeon has actually debated this a lot, that when can we not do those oral antibiotics? And what he's found is that you need to be doing 3 to 5 rounds of the IV antibiotics to make up for the efficacy of the oral antibiotics. So if you're going to do IV antibiotics, we recommend that you do it the day before, the day of surgery, the day after surgery, and then another day or two after that, just to make sure it's in your system and you've got enough. 7-year-old has a large cavity, some decay on a premolar. Premolars right here. We've been flossing and putting tooth putty on every night. Don't want to do a crown. What are the other options? So if there's a large cavity and some decay on a premolar, the challenge with a 7-year-old is that is a baby tooth, and the cavities in baby teeth progress very, very quickly. So if that has been growing, you need to get the cavity stopped right away. That's the first answer. You need to get the cavity stopped right away. So you need to get that decay out of there. A crown on a baby tooth is a much different situation than a crown on a permanent tooth. And it may be to keep that tooth in the mouth, it's going to require a crown because there's just not enough baby tooth left to be able to hold anything in, a filling in. Fillings are very difficult to hold in if they're large, especially on that tooth. That's the one tooth that's really notorious for having fillings break and fall out and new decay. So your choices are either get it filled and probably do a crown, or take the tooth out and hold the space. Now, you may not be ready for taking the tooth out, so then do a filling or the crown. If you do take the tooth out, you do have to hold the space open. Otherwise, the tooth behind it moves into the space and there's no room for the permanent tooth to come in. So, and maybe that you're going to just have to do the crown on this tooth and know that it's going to be a few years and then that crown's going to be out of there. There are porcelain crowns on baby teeth too. I have old, large fillings in my back teeth with hairline cracks. Are crowns a good option? So, yes, just kind of answered that one. It sounds like old, large fillings, cracks, yes, crowns or onlays. I got a root canal infected. What should I do after the infection is cured? So if there's a root canal infected, there's no way to cure that infection. That's the first problem. If a root canal has reinfected, what that means is there's dead tissue still in the tooth, bacteria have been attracted to that dead tissue, and that is infected. Until the tooth is gone, the dead tissue is gone, the infection is going to return. So the only way to take care of that problem is to remove the tooth and replace the tooth. My last Amazon order for your mouthwash was canceled, is out of stock. Is that temporary, or are you no longer selling on Amazon? No, we are ramping up on Amazon. I'm sure that was temporary. It's crazy. The second we get stock at Amazon, it is sold that fast. Like, it is gone. So we are just trying to scramble to keep up, actually, to keep up with keeping it on Amazon. No, but go back. We got it on there again. We're shipping it out as fast as we can get it to them. My upper back molars have swung outward. What's going on? So, interesting question. If they've swung outward, oftentimes what's happening is most likely you have a tongue issue. There's not enough room in your mouth for your tongue to fit, so your tongue's putting pressure sideways and kicking those teeth out some. So this goes back to airway problems. Do you also struggle to sleep at night? Do you feel rested when you wake up in the morning? Do you snore? Any of those kinds of things going on? Most likely there is an airway problem happening if those molars are being kicked out. So go get a cone beam CT scan and go get that checked out. You probably need to do some expansion. We probably need to intentionally move all the teeth out some to make more space in your mouth for your tongue to function. Will you have kids' gut supplements available to buy? Yes, we are working on that right now, actually. So thank you for giving me a little kick in the pants on that one. We've been working through products, but that one's one that's really, I think, going to be an important one to do. Kids' gut supplements. We're also working on a kids' mineral supplement. So those are two things in the works. Yep. I was wondering if all nanohydroxyapatite dissolves in the stomach acid. I might have misunderstood your blog. All hydroxyapatite does. It dissociates is the word. So basically it's a complex of minerals, and when it hits the stomach acid, it breaks apart into the individual minerals. So there's research showing that in stomach acid, it breaks apart into those individual minerals. So the minerals are still available for you to then uptake into your tooth, but they're not available as that complex called hydroxyapatite, if that makes sense. You can read the research on that one. It's really an interesting one. I got a bridge about 2 months ago and haven't felt well since. I'm sorry to hear that. So if you got a bridge, there's a couple of things that can make it so you're not feeling well. Number one is bite. If the way they're fitting together don't fit right, it can be causing some issues with your bite and jaw and all of that. Also, a bridge is sometimes pretty traumatic on the tooth that's holding the bridge. It may be that tooth has actually died. So you need probably a cone beam CT scan to take a look at that and see what's going on with it. You also can look at materials. What was the bridge made of? Was there metal underneath there? You can get a material reactivity test to see if you're reactive to the metal, to the material that it was actually made of. You can do that as well, and that may be something to do also. I want to say thank you. I lately found an old root canal tooth had gone bad and had it removed and had ozone injected. Your free information helped me a lot. Oh, I'm so glad. Thank you for telling me this. I love to hear stories. Yesterday, I had a patient who actually brought her father in, and she said, it's absolutely been a miracle since I got my work done with you. She's like, I got the infections cleaned out and I'm sleeping like a baby. She's like, I just did not even think it was possible. It literally is life-changing. So I just love hearing stories like that. Thank you so much for sharing. Sorry for this cough. I have a cracked tooth with a crown. I clenched at night and hand pain. One dentist said I needed a root canal. The other said I would know it would be painful. Sometimes it's sensitive. Third opinion. If it has a crown, usually the crack is taken care of. The root canal is only necessary if the tooth has died, and root canal is never necessary anyway. If you listen to me at all, you know that that's never a necessity. If the tooth is dead, then you have a choice. You can do a root canal or you can remove and replace the tooth. But that's the key, is the tooth dead? If it's still painful, meaning sensitive to hot and cold, those kinds of things, it's not dead. If it's hurting to bite on, if it's hurting down low or above the tooth, wherever it's at, then get a cone beam CT scan. It may actually be dying. I have a cavity in my upper jaw tooth. It has an old filling. My dentist wants me to have a crown, but he also said I could have a filling. What are my thoughts on this? If there's a cavity, if there's enough tooth for a filling, do a filling because it's more conservative and it's going to save tooth structure. Then keep using the tooth powder and just make it so you never get another cavity on that tooth. In your July 2nd live, you mentioned a product to help with suspected cavitations while waiting for treatment. Notosan. Can you direct me where I can purchase this? Yes, so Notosan is actually a homeopathic antibiotic. We get it from a company called San Pharma. I believe it's out of Germany. You may not be able to get it without it being a prescriber or have some sort of license. So look at that and see. I know there are some companies online that do sell it, however, as a third-party sales source. So Notosan is what it's called. Notasan from San Pharma. And it is a homeopathic antibiotic. I have a root canal in my right upper molar that throbs all the time. I want to have it removed. Any tips on the removal? Yes, definitely some tips on the removal. You want to make sure that you're getting the ligament surrounding the tooth removed. So make sure that that's intentionally removed because it isn't just automatic. I recommend ozone because that gets into all the nooks and crannies in the bone and kills all the infection there. and then also stem cells afterward. Stem cells go into the area and initiate bone healing. So those are the three things we always make sure that we do. Would it be okay to have open sockets at 30 and 31 and then pregnant and then get implants after, trying to prevent too much disruption while trying to get pregnant? Yes. So basically, you're saying, would it be okay to take a tooth out and then leave nothing there while you're getting pregnant, going through pregnancy, and then putting the implants in after? It is. Just know that you will lose the most bone within the first 6 months after the teeth are removed. So you're going to lose some bone. You may have to do bone grafting, but you may have to do bone grafting anyway. A lot of times we have to do bone grafting anyway. So just know that that may mean that you're going to have to rebuild the bone some after the pregnancy, but absolutely possible. Do I like Invisalign in kiddos for expansion? Yes and no. It depends on how much expansion we need. The beautiful thing about kids is that we can get a lot of expansion because they're still growing. They're still malleable, they're moldable, we can change things a lot. So that's why we often will use a fixed expander or something that's glued in that they can crank and keep moving it out. And it's pretty hefty. You know, it does a lot of expansion. We can expand with Invisalign, but a lot of it's going to be tipping more than actually expanding. So sometimes it's recommended to do a different kind on a kid so that you can get a little bit more expansion. I had a cone beam scan to look at an old root canal. The dentist told me it was fine. I don't trust them. What I heard you say before is almost all root canals have infection or bacteria left in them. This is exactly what I find. Almost all root canals have bacteria or something left in them. Do I find some that don't? Yes. Do I think they probably do? Yes. I think it's probably just not visible on the x-ray yet. Probably small enough. But that's always your choice. It's always your choice in my office. That's what I tell people all the time. This is your choice. You know, you get to choose. This is your tooth. Now you know the risks versus the rewards, you know, of having it removed, of leaving it there. And if you choose to want it to have it, you know, have it stay around for a little while, it doesn't have a massive abscess. So it's probably, you know, going to be okay for a little while, but your symptoms are the ones that guide you. You get to decide, what do you want to do? I'm on the verge of getting implants. What do I suggest? Absolutely ceramic dental implants if you can find them. So ceramic dental implants are non-conductive and the body just loves them. So that's what I recommend for dental implants. Do I suggest removing metal fillings and the whole tooth if the tooth is fractured? So if the tooth is fractured to the nerve or below the bone level, there's no other option than to remove the tooth. If you just have a fracture next to an old filling, remove the filling. Sometimes you can just take that cracked part out and then you can cover it over with an on-lay or a crown. So it depends on how deep that crack goes. What kind of bristles are good for a 2-year-old? What to look for? Is BPA-free plastic okay? Yes, BPA-free plastic is great. You know, the concept here is that it's not in the mouth for long, which is great, and they should be pretty inert. But that's typically what we have. Our toothbrushes are that BPA-free plastic. Just so you know, I'd signed up for a regular monthly subscription on the mouthwash. They won't let me reorder. As of today, it only listed as unavailable. Hopefully, we're getting that very soon. That's a manufacturing issue. So again, because we've been selling so much of it, the manufacturer is having a hard time keeping up with our demand as well. So keep checking back. We will get it soon. I promise. I hate that we're out of things as well. It drives me absolutely batty, but we're working hard on the manufacturers to get it back in stock. My dentist drilled the top of my teeth off on both sides. Now my teeth touch in the front and it hurts really bad. What do I do? That's frustrating and that's a hard situation. When they adjust the back teeth, it will lead to teeth touching too hard in the front. I would give it a little time to settle down. I would use the tooth powder and use the powder as a paste and rub it right into those adjusted teeth and see if you can't get the jaw and the muscles to settle down a little. If not, you may need to go visit with a dentist that does work with the TMJ, with the jaw and the bite, and get things balanced again. How do I feel about a cadaver bone graft after a tooth removal? You know, this is actually an interesting one because a lot of health-based dentists like myself won't touch cadaver at all because it does create an immune reaction in the body. However, I have a periodontist that does all of my surgery here on staff, and he's phenomenal. And he has done extensive research in this area. And his goal is that when he does a bone graft, it's enough and it's going to work. And you're going to be able to have enough bone to be able to rebuild whatever you want. And he basically has told me straight out, there is no way to do the kind of grafting that we do here, where we're really literally rebuilding jaws without some sort of cadaver bone material. So we do use cadaver at times. We try to do auto harvest at times as well. What does that mean? That's the thing we do most and first if we can. Means if we need a block of bone, we'll go get it back here where your wisdom teeth were removed. We'll take a little block out over there. If we need some ground up bone, we'll do the same thing where if we're taking a tooth out, we'll grind up some bone right in that area and put it in that spot. So we try to use your own if possible, but sometimes we do need cadavers. So what do? We work with the immune system to help mitigate that immune response. We help it work its way through it because sometimes we find it's necessary. I had 4 teeth removed to help with my braces as I had an overbite. After all these years, my teeth seem to have gone back to being narrow and getting an overbite. My dentist suggests a mouth guard. I talk about this all the time, see this every single day in my practice. If they've removed teeth, they've made your teeth too small. And what you actually now have is your muscles and lips and tongue and everything can't work inside of that space. So you get a lot of movement, a lot of push pull. A night guard's not going to do really anything for you. What you need is you need an expander to expand back out and make more space in your mouth for everything to function. All right, we are almost at the end here. Let me grab a couple more as we finish up. We've talked a lot about implants, so let me take a couple of these real quick. What do implants roughly cost? It's so hard to tell you because I don't know where you are living in the country, Typically, they're going to be around the $5,000 range. That's, everything top to bottom. But like I said, it's just really hard to know because I don't know where you live. Here, it's going to be a lot less than if you live in New York or California. But that's a rough estimate. What was the name of the implant that our mouths love? It's called a ceramic or zirconia implant. So ceramic or zirconia. I'm just going to jump on these real quick and make sure. My dentist is pushing a root canal. I really don't want to. I've had a really bad experience with my last root canal. Then don't do one. It's your mouth and your body and your tooth. Just say, I'm not going to do that. So what are my other options? If they say remove the tooth, then that's your option. Or if they say, well, let's try to keep it, healthy, then let's do that. So those are your two options. Try to keep it healthy or remove the tooth. I need multiple root canals. How to do this in a natural way possible on a very tight budget. Is there any hope to fix all the issues I have with my teeth? I'm going to be really straight with you. If you're going to pay the money for multiple root canals, you're going to be paying more money later for multiple crowns. Then you're going to be paying more money later for multiple redo root canals, then multiple extractions, then multiple implants. So let's just shortcut the process. If you have multiple teeth that need root canals, I recommend that they actually be removed. And you make a plan for replacing the teeth because you can make something like a partial denture, even with 1 or 2 implants that can snap onto a couple of implants and can replace multiple teeth already. So lots of options there, but I would not have multiple root canals if finances are tight because you're going to just keep pouring money into those teeth and eventually you're going to lose them anyway. That's what I just see day in and day out. So that's just me being really straight up honest. I wouldn't do it. I'd remove them and replace them. I'd use the money to do that. I just got the gut health supplement for my spouse. Can he still use Prilosec until things get better or should he stop now? Also, do you take digest and weight at the same time or one after another? Okay. I'll never tell anybody to go off of any kind of supplement or any kind of pharmaceutical. That's not my job to do it. But sometimes people do when they're on the gut health supplements. But we don't go cold turkey. So we start weaning off. We go down to half a tablet. That's what they do. When they do it on their own, they go down to half tablet. They go down to maybe 3, a quarter tablet, whatever it is. They just wean themselves slowly off of it. The gut well and the gut digest. Gut well is only needed if you have pain. The digest is needed with food. So they are going to be separate. Gut well is for pain, for soothing pain. And, gut well is not. Gut well is after. That's gut soothe I was thinking of. Gut well and gut digest. Gut digest, yes, you're going to take them at the same time. Had to think back for just a moment. Digest, HCl digest, is going to help you to digest the gut well. So yes, take them at the same time. Okay, thank you all. What kind of implant do I recommend? Ceramic zirconia or zirconia. It's the same. It's a different name for the same thing. Thank you all. I've got to go train my care coordinators now. We're going to be talking all about how to help you better. So thank you all for being on here. We actually are going to be Tuesday next week. So Tuesday at 11 a.m. Jump on. I'm going to be doing all your questions again. Thank you all. Have a fabulous weekend.